Welcome back. You tuned into the South African Morning Now. Committee has been established to decide on COVID-19 vaccination for adolescents. It follows an appeal by anti-vaccination organisation Free the Children. The committee is comprised of health experts chosen by the health products regulator and the aggrieved organisation. It will be chaired by Advocate Tembeka Ngqaitobi. Let's discuss this further with John Taylor now of Free the Children, Save the Nation. John, many thanks for your time this morning. We were just talking offline about the level of importance of this particular conversation. And perhaps if you could just start by drawing the viewer closer on your standing as Free the Children, Save the Nation.
Yeah, thanks very much for having us live on the show. And it's most welcome to be on a national platform. You know, most people don't want to hear alternative views when it comes to the mainstream media. And there's so much to be learned from alternative views, and following the scientific process of open debate and discussing your findings and rigorous analysis of various alternatives before you make a decision. Free the Children is started by myself shortly after the incidents in China, and we were extremely concerned at what looked like a misrepresentation of the way that viruses behave, the way that people behave when they are infected with viruses, and we've been tracking the progress since then. And we were naturally concerned about the most vulnerable groups of society being exposed to this. And as a grandfather and as a concerned citizen of the world, I decided that the focus would be on children and the protection of human rights for everybody, not just children, but adults as well.
Right. What informs this adverse effects that you perceive may happen to adolescents should they be getting the Pfizer vaccine, or the fact that you're appealing this particular case at the moment? If you could just maybe broaden it for us in terms of what's informed this appeal that you all have embarked on as an organisation.
Yes, we were alarmed when we saw that the SAPRA, the South African Health Products Regulatory Authority, had decided to approve the vaccine for children from 12 to 17 years old, because that's an age group that is extremely robust in terms of their natural immunity. And there is a growing concern already was coming out of the United States, which had started early in the rollout of vaccines to younger children. And there were reports coming through of adverse events amongst those young children. So we decided that we wanted to find out more about the approval process and exactly what information had been presented to SAPRA to make the decision that they did make. And we initially had a meeting with the CEO, and that didn't go anywhere because they wouldn't give us the information we were looking for, which then led to us going to the Minister for an appeal committee hearing.
Right. What is your hope in terms of an ultimate outcome here? Because there are various arguments around vaccinations in the country at the moment. You know, one of them being that it's the only way to return to some form of normalcy, whether it be a child all the way through adulthood that gets vaccinated. So you as an organization, ultimately, what would you like to see? Because at the end of the day, what we're trying to do is contain and manage the virus. We can't take it away because it's here to stay, but we can manage it through the vaccination process.
I think there's a basic point of departure difference in your statements there. And the simple thing is that it's been proved over and over, and it's in fact been proved extensively now if one looks at a country like Israel. And in fact, you can see it happening in the UK and in the USA. Vaccination on a continual basis is exactly the wrong way to go, because all you're doing is you prolonging and exposing yourself to greater and greater destruction of your natural immunity. And the vaccines, the way that they work is they don't cure anything. All that they do is that they are supposed to assist your body to fight something naturally. Now, that's not happening if your natural system is being attacked by the injection itself. So the results are there. All you have to do is look at Israel, for argument's sake, and see the escalation in cases, infections, and in deaths. And that's not the road we want to take. We want to take a road which takes us back to normality, a road which says natural immunity is the most robust immunity, particularly for the younger age groups, and that if people still want to have themselves jabbed, it's their decision. But it's still not, we think, the correct road out of the crisis that has been developed, which I must add is not a crisis that is entirely natural, in that it's not been driven purely by the virus. It's been driven by
I hear you, John. I absolutely hear what you're saying, but you speak about Israel as an example, and we'll stick with that example. Granted that children might have a stronger immunity than adults and may not need to get vaccinated. But I mean, Israel, for example, has now embarked on a journey of vaccinating babies. They're set to start doing this from April. John, at the end of the day, not all children will have the same kind of immunity. And I think the focus should be on protecting everybody as best as we can. And I don't know if this narrative of not vaccinating is the correct one.
If you look at that, the story that's been spun by the spin doctors and by the main media worldwide is get your first jab, and then you can throw away your mask and you won't have the virus, and you'll be safe, and the people around you will be safe. And that's exactly what's not happening. They're still having to keep their masks. They're still having to have more boosters. And they still are picking up the virus, and they're transmitting the virus.
That hasn't been the narrative. I think the communication that has come through from health authorities globally has been very clear. The vaccination doesn't prevent you from ever getting COVID-19, but we've seen evidence over the last few years that we've been using the vaccine, or months rather, that hospitalizations have reduced dramatically, deaths have reduced dramatically. I feel like even the strength of the variants that are coming through are no longer that lethal on humans as we saw previously. And I think it would be remiss of me not to highlight to you that health authorities have actually said we need to continue with wearing our masks, sanitizing, social distancing, being as safe as we can, but at the same time taking our mask. At no point has it been said to us that we no longer have to follow these protocols if we are vaccinated. The message has been rather clear.
So what you're saying is there is no way out of this. That's essentially what you're saying. You're saying that we're stuck in a loop, a Groundhog Day loop, where we are forever going to be masking, sanitizing, jabbing, keeping away from people. That's not life. That's life as a lab rat, and that's not what humanity wants. Humanity are not lab rats. Humanity have survived for millions of years on the basis of their natural immunity, and that's what we need to rely on in the future.